Well, speaking of AI and talking with a medical professional, we are joined by 9 News medical expert Dr. Payal Kohli, and we want to discuss with you, Dr. Kohli, the use of AI and our health, specifically using it as a fitness coach.
Yes, have you guys tried this?
No.
Sounds like a good idea,
I think it's a great idea. It's fabulous. In fact, I've tried to use it myself, and I've also told a lot of my patients to use it. So if you think about what does a fitness coach do for you? They make workout plans, they give you feedback on your training, and these are all things that AI is very good at doing. But you can also use it for nutrition, so it can help you with your diet plans as well. So I would encourage you guys to think about ChatGPT, Coach GPT, or Claude, perhaps to motivate you as well to stick to a fitness plan. So think about it like a dietitian, a fitness trainer, and a doctor kind of all rolled into one, giving you personal fitness advice.
Yeah, it sounds good. I've started to use AI and ChatGPT more in my everyday life, and I'm learning the questions you ask are so important for the results that you get. So from your professional standpoint, what types of questions should you be asking?
So the best questions when it comes to fitness and nutrition are really the informational questions. So I tell my patients, okay, follow a low-fat diet, but Dr. Kohli, what does that really mean? So you type it into AI, it's really good at spitting back information to you. What it's also really good at is making plans for you. So if you say, I want to train for a half marathon, and I have 3 months to do so, and I have an hour a day to devote to training, make a plan for me. It's really good at doing that. What it's not good at doing is really giving you feedback on how you're doing. So that's where they start to fall apart. So if you are not doing well on your plan, or you're training in a way that's going to cause injury, or you have a chronic health problem like a joint issue, and it doesn't know that, it can actually set you up for failure rather than success.
Would you say there's any additional drawbacks or benefits aside from that?
Yes, I would say the right type of person has to use AI, and you have to use the right type of AI. So you don't want to put a lot of medical information, as we just talked about privacy concerns, into AI, because that's not necessarily protected. You want to make sure that the AI, because in a lot of new apps now, I don't know if you guys know, but Peloton and some of the other ones actually have cameras where they look at what's called biometric feedback. They look at how your joints are moving. I think Tonal is another one that does that. Sees how hard you're struggling with weight and then tries to smart adjust it. But remember, these algorithms are not validated. So by looking at you in the camera, it can't necessarily tell whether or not you're setting yourself up for injury or not. So you really want to be attuned to what your body is feeling. The AI doesn't know how your muscles recover. So if you wake up the next day and you're sore all over, and that AI says you better do it for an hour today, you better run because that's part of your plan, then you got to make sure that you tell the AI, not today.
Okay, that's a good point. Because it also takes pictures. I wonder if I can put a picture and be I want my abs to look like this by June 2nd.
How do I do it?
Would it give me some exercises?
It would. And so this is a great way to use AI. If you have a goal you need to get to, you're starting out, giving in that before and after and giving it the time period. But here's what I'll tell you. The AIs are designed to make you feel good, right? And in general, fitness AIs are meant to be motivational, and they're about engagement. They want you coming back. So most of the times, the bad AIs will say positive things, even when what you're doing is not positive.
Oh, no.
So I want you guys to test your AIs, okay? And this is how you do it. You want to say, I want to lose 25 pounds in 2 weeks. That is an unrealistic goal, right?
No.
And if the AI says, okay, let's make a plan, that's not a good AI. It should say, nope, that's not realistic. You need to iterate. Or you say, okay, I've dropped my weightlifting from 30 pounds down to 10 pounds. And it says, good job. No, it should say, looks like you're falling off the curve. So you really want to actually continue to test your AIs to make sure that it's keeping up and performing the way that you want it to.
Okay, good information. That's interesting. All right, Dr. Kohli, thank you.